The airline, thank you. We also want to bring in Michael Rocque, professor of sociology at Bates College, right there in Lewiston. First of all, thank you for being with us. We appreciate your perspective.
Of course.
You've spent a large part of your career studying mass shootings, not just specifically Lewiston, of course, as well, but other ones around the country. So we appreciate you joining us.
Yeah, and we spoke to you the night of the shooting, both that night and then a week later. We didn't know much at the time. We've now learned as much as we're likely going to learn. We're just wondering, how common is it to see a commission like this after a mass shooting?
Well, commissions are starting to become more common as we continue to grapple with these types of events, unfortunately, and people are sort of tearing out their hair, trying to figure out what are some solutions that we can actually implement that will be effective, but also will be politically viable. Unfortunately, that's part of the equation as well.
Yeah, we didn't seem to learn anything today that was really earth-shattering, including recommendations to state police. The blame was kind of passed back and forth. Is this typically what we see come out of a report like this?
Unfortunately, I had written when I heard that the commission was being formed that I would have enjoyed an invitation to join. You know, I think that there are ways to have commissions do some work that is a little bit more effectful and impactful. I mean, this was a good amount of work, but it basically told us kind of things that we've already known.
Some familiar notes there. The commission referenced kind of the bureaucratic process within the Army, and that it slowed down their process. In fact, their original goal was that they would have a report in 6 months. They referenced today it's been 10 months, and they acknowledged some of those reasons for that. Is it unique for a commission looking at a shooting to have to factor in a military unit, multiple states involved as well?
Not in this manner. There were so many warning signs, people reporting, people concerned, from healthcare facilities to the Army Reserve to his friends and family, that an effort to gather information from that many different organizations is pretty unique.
Along those lines, one of the other things in the report is that a number of people, including Robert Card's family members, acknowledged his declining mental health condition, sought help, tried to connect him with resources, were unable to do it. There are a number of paragraphs that outline that. Is that a common thread that we see through the reports that come out after shootings?
Not in this, again, not in this manner. I mean, there were so many people that tried and repeatedly tried. And there were good faith efforts, I think, on the part of a lot of organizations, but the failure to get him the help that he needed is really the sort of lasting lesson from this entire case.
You studied a lot of mass shootings, which is why you're really one of the best people to speak to about something like this. And you mentioned the word failure. If we know we're failing people, why is it so hard to come to a common ground about policy and how to move forward?
I mean, I think you see it with policy, it's political. There are so many different interest groups that have opinions about which types of policies and which types of approaches. You know, one of the reasons we don't have a red flag law in Maine is political. Unfortunately. And so you have to find a solution. We think we know solutions that are effective, but it's another matter to have them be legislated and accepted by the public.
I went back and watched your original interview the night of the shooting with Chris Costa. It was hours after it had happened. Again, you're a professor at Bates right there in that community. Right. Chris had asked you what you were feeling, and you had said you were having the feelings that anybody has when their community is attacked, including shock. 10 months later, we've all moved on to a degree and processed. With your perspective of studying these events, where is your mind today, 10 months later?
My mind is optimistic, actually. I think that, you know, a lot of these events happen and there are fumbles and missteps and nothing happens. But it seems that the community, law enforcement, the governor's office, they're all still engaged, and they are not forgetting. You know, I still see Lewiston Strong signs everywhere. In fact, I was in Boston in April and I saw somebody with a Lewiston Strong t-shirt. So I think that there's momentum and it has not dissipated, and that only gives me hope.
Encouraging news there, and a good point to leave it on. Michael Rocque, professor at Bates College. We appreciate, once again, you checking with us on this process.
Thank you.
Thank you, thank you. And hearing these conversations and seeing these images, we know it can be hard. If you or someone you know is struggling, with their mental health. There are resources available. In Maine, you can call the crisis line at 1-888-568-1112. You can also call 711 if you have hearing loss or a speech disability.
And keep in mind the National Suicide and Crisis Lifeline can also be reached at 988 anytime.